John Watley MD just released a book called When Politics Comes Before the Patient. Sean and I have had a conversation here before on one of his blogs, and I sent one of my articles in the medical journals. They've taught millions of people of patients comatose, labored shallow breathing, turning blue from lack of oxygen, making funny breathing noises, deny rescue breathing, and pound on a beating heart. Taught millions of laypersons to do that, and they're eagerly doing it to anyone who's comatose. They're killing their own children because the government told them to, and everybody lives in denial and says nothing, makes themselves sick. There's Tepler called Eric Hoskins right here at Toronto Public Health head office. That's chest compressions. More chest compressions. This is June 12th. This picture taken. This is June 12th. The chair of the Board of Health. I just got back from a...
Anyway, just for people's information, I was called to a press conference with the Health Minister of Ontario, Dr. Eric Hoskins, and the very good news was that the province has agreed to fund $450,000 worth of staff for us. That will mean 4.5 people to implement our drug overdose plan. They will also be funding 80,000 naloxone kits for the province of Ontario, and a good number of them will go to the City of Toronto, of course. And within that, the public health units across Ontario have been designated as the institution that will be managing the naloxone distributions in their jurisdictions. So that's a good thing as well. So I think frankly, the province has done some good listening on the issue of drug overdose and the harms that come from that, of course, and the deaths that have come from that. And they have responded very well with a plan and also with a good amount of money. So that's... And the people who clapped the loudest actually deserve to be clapped for, because they provided the impetus and the encouragement to keep us on the straight and narrow. So right back at you, back there. Yeah.
Zoe Dodd was there and said, "Be careful what you wish for." Zoe Dodd is the founder of Moss Park Overdose Prevention Site, which gives rescue breathing, oxygen, no chest compressions. Because Zoe's saving non-drug overdoses and drug overdoses, teaching people to get rescue breathing. June 12th, press conference at Toronto Public Health head office. Chest compressions only. More chest compressions only. No rescue breathing. January 9th, 2017, Mayor here, John Tory, with the Associate Medical Officer of Health for the Province of Ontario, Dr. Barbara Yaffe, said it's rescue breathing. John Tory's quoted, "This is what causes people to lose their lives," quite literally. Yeah, non-drug overdoses and drug overdoses, because the signs of drug overdose can mimic any of the hundreds of causes of breathing emergency. And if you've got a breathing emergency, chest compressions and deny rescue breathing is murder on both counts. For some reason, millions of you are following this mass murderer's instructions. Dr. Eric Hoskins, MD.
Was the CEO of the Canadian Helen Keller Society, and I just feel sorry for the people that cause themselves needless death and deafness and blindness. There's this deals issue with the funding for HIV and harm reduction and child youth resiliency. So we need a lot more funding for harm reduction. HIV prevention, etc., and children resiliency. But Toronto Public Health has spent a lot of money on a program that's costing you a fortune. Public Health has just started 25 training sessions that are going up around this city. They have a capacity for 1,200 people. It's the naloxone program. They are not distributing naloxone at these events, but they're teaching all people all the signs and symptoms of respiratory emergency. Then chest compressions is included. As Dr. Davila just mentioned, eating cannabis causes you to go into respiratory failure if you get a large dose of edibles. So, I'm just trying to save lives, and it's a no-brainer. There's over 1 million people taken to the hospital per year with a respiratory emergency. They need respiratory assist. Anyway, you guys have a great one, and I hope Mr. Hoskins, you got him straightened out.
The paramedic service is actually very well prepared. They all have naloxone. The most important thing when they get on site is actually ventilation as well as oxygen. But I think what we heard loud...
Because that precise example was used as to whether other first responders should have naloxone, and it was said that that was not the case, that the priority, for example, when the fire department are often the first to arrive, should be on ventilation, as Dr. Yaffe just said. But let me just say this about the disaster or crisis that comes to affect a big community. What's the one thing that often stands in the way of effective dealing with it? It's different protocols people have, different ways they collect information, different information they have, and the whole idea of this partnership, and I commend those who pulled it together before I got involved, is to get everybody around the table so you can start to produce numbers, that they're collected in a common fashion, that they have protocols that are well agreed upon so that when things get worse, if they do, hopefully not, but when they do, that we actually can deal with this, as opposed to sort of saying, oh my goodness, this person didn't tell me that, or we have a different system here. This is what causes people to lose their lives, quite literally.
That's right, John. Anybody with any respiratory emergency, they're giving them chest compressions.
That is, I mean, I think a few months is